You're watching CTOM TV. Knowledge is power.
April would like to ask about her father-in-law. My father-in-law was diagnosed with very early stage CLL. Recently, we have found a tumor on his kidney, which they expect to be RCC. Is this a common occurrence in CLL patients? Sorry, what's RCC?
A renal cell carcinoma.
Thank you. So CLL, there's a new tumor and they think it's renal cell carcinoma. Is this common?
Well, it could be. I think, you're really going to have to look at that tumor and do pathology.
Tumor tissue testing.
Yeah, definitely.
Yeah.
You can't make assumptions just by location.
Yeah. And when you say pathology, let's be clear, because in public health care, there is a certain amount of pathology done, but that's not the same thing as genetic testing.
No, it's not. No.
So what are you talking about?
I'm just talking about basic pathology.
Okay.
Stains for different receptors and different cytokeratin markers and so on.
Mm-hmm.
So they'll be able to tell that right away.
So whether it is
Renal
RCC.
cell. Yeah.
Mm-hmm. And the question is, regardless, is that common?
It's hard to say. Definitely, you're going to see metastatic deposits. Depends if it's in a lymph node. Depends, where it is.
Right.
I mean, CLL is a lymphatic disease, so you would assume that it's a lymph node.
Mm-hmm.
But it's really hard to tell. You'd have to really, once again, do the imaging and the pathology.
Right.
And then, once you have that information, you can determine how it's going to impact or change treatment.
Okay. So the imaging, tell us about that.
PET-CT is something I would definitely go with for something like that.
But the PET-CT is not going to tell you CLL versus RCC.
No, it's not.
It's going to tell you where all the tumors are and how aggressive they are.
Well, it's going to tell you to a certain degree where the tumor is and whether it's in a lymph node or not.
Okay. And that has some bearing on the RCC thing?
Yeah, because we're looking at a disease that is a lymph node based disease. CLL is chronic lymphocytic leukemia.
Okay. All right. Okay, so I guess the answer, April, good that it's very early stage.
Mm-hmm. Get it tested.
Yeah.
That's the answer.
Yeah, get it tested. And if possible, have a PET-CT, and that way it's just that makes it easier for them to tell what stage the disease really is, where the most aggressive tumors are for surgical excision. All sorts of valuable information comes from that kind of imaging test, for sure.
Thank you for watching CTOM TV. Subscribe below and stay informed.